feeling small. When tears are in your eyes, I will dry them all. I'm on your side. Oh, when times get rough and friends just can't be found, like a bridge over troubled water, I will lay me down. Like a bridge over troubled water, I will lay me down. Hey, when you're down and out, when you're on the street, when evening falls so hard, I'll comfort, I will comfort you. I'll take your part. No, when darkness comes and pain is all around, like a bridge over troubled water, I will lay me down. Like a bridge over troubled water, I will lay me down. Like a bridge over troubled water, I will lay me down. Like a bridge over troubled water, I will lay me down. Ooh, down, down, lay me 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 down, now, lay me down.
Welcome, folks. Thank you for joining us today for part 2 of our racial equity audit webinar series with Ashley Stewart. And I'm just going to intro us into today's event, and then we will get to our speaker. If you haven't joined us previously, welcome. And if you did join us for our previous first session, welcome again. I am hoping that you will get just as much incredible information out of today's as you did from last time. So just to start, I will be bringing in Ashley, but just so you know, presenting today will be Ashley Stewart, PhD, who is the Director of Health Equity and a Racial Equity Subject Matter Expert at C4 Innovations. We are one of the organizations that partners with New England MHTTC on the events. So this will be another fantastic one. All right, we'll go on to our housekeeping information just for you to know. Today, microphones will be muted during the presentation. However, Ashley is one for you to really get vocal and let us know what your thoughts are. So we will have opportunities for you to also unmute, and you can always raise your hand to indicate that you'd like to have something to say, and we would love to hear from you. Closed captioning is also available for this event. You click on closed captioning icon at the bottom of your Zoom screen to select a transcription option. It'll be all there. This webinar is also being recorded, so the video archive of the event will be emailed to participants. For folks who were on our last one, I will be getting that one up on YouTube, so be looking out for that coming to you. And also, if you have any other questions, you can feel free to put them in the chat box. You can put them in the Q&A. Wherever you put them, the team will be there to see them. And also, if you have any questions after this session, please email newengland@mhttcnetwork.org. And then we'll also put our individual information in there so you can get in touch with Ashley, for example, if you'd like to after today's presentation. Just a couple quick ones. Our funding comes from the Substance Abuse and Mental Health Services Administrations, aka SAMHSA. The views and opinions expressed in today's session are those of the presenters and moderators, not SAMHSA. As well, the Mental Health Technology Transfer Center Network uses person-centered, affirming, respectful, and recovery-oriented language in all activities. So during this session, please ensure that whenever you're contributing to our discussion, that you are also using that language that is affirming, respectful, and strengths-based. As well, as a committed ally, the New England MHTTC network recognizes that the New England area is home to the ancestral land of many Native tribes. Consistent with our values of community and inclusion, we acknowledge that all the places our distributed staff live and work, as well as where we provide services and hold events, are Indigenous lands. So for myself, Lee Lockhart, I'm your tech support for today. I am calling in from Nipmuc, Pecumtuck, and Wabanaki Confederacy land. If you are curious to learn more about where your current residing or where you provide services, I will put that in the chat in just a second. But to get us to the most important part of today's event, on camera, you will see she's here, folks. I felt like I wanted to do the bum ba dum ba. That's I'll stick with it. Bum ba dum ba. It's Ashley Stewart. I will drop the share screen so that you'll be able to share your slides, Ashley, but welcome. And thank you for being here to do part 2 of this session.
Thank you so much, Lee, and thank you all for being here today. Let me know in the chat, how are y'all feeling? How's your day going? Would love some context to that. Tired? Yes, absolutely. It's been a traveling week for me. You'll see I'm clearly in hotel. Sick. Oh, I'm so sorry to hear that. I'm excited that you're here as well, and hoping that folks who are under the weather, that you have an opportunity to feel better soon. Feeling, just working hard, feeling fantastic. I love that. I love that very much. Awesome. Well, I'm really excited to be here. Continue to type in the chat. The first thing I'm going to do is I'm going to take us through a little refresher, because if you're anything like me, you're like, what did we talk about last week? And so I want to make sure I take opportunity to reflect back on what we did cover last week, get us all on the same page, and then, of course, jump into our content for today. Just so folks know, if you weren't here last week, we're going to do some more like didactic stuff today, meaning like I'm going to ask you to maybe look at um, a website, or we're going to kind of do some auditing process together. And so we'll have the opportunity for that. But just to quickly recap what we talked about last week. So we started off with a little bit about the series. We talked about how it'll address language, responding and advocating around racial equity topics. We talked about what this would look like in terms of, Leah's still not able to share. Thank you. We talked about what this would look like for different multitude of intersectional experiences. And so I gave a little background context to myself about being the director of equity at C4 Innovations, getting to do this work in a really dynamic and profound way. My background being in social justice, being a professor, and now being able to do the work that I would study and research in such a translational way has been a really huge part of this journey for me, and really excited to share it. So we talked about how we'll talk about identity-based forms of oppression, including but not limited to sexism, ageism, heterosexism, transphobia, linguistic and religious-based oppression. We also talked about that we would go over an assessment, the tone, the essence of a website, and then the essence of engagement. So we're going to do some engagement work today. We then did some introductions last week and went into these equity center best practices. I asked folks to kind of share with us which one stood out to you. A lot of people like the revisiting welcome. They asked for clarification. We had a great conversation about that. Next, we talked about what is an ecology and how does that involve a person and environment as we're looking at systems as a whole, as we're looking at organizations, really understanding that we're leaning into the interaction between people and then those systems. We talked about what the latest research says about diversity and inclusion, and how essential and important it is to be diverse, to be inclusive, but that diversity and inclusivity are not synonymous. And in fact, we can promote the idea of diversity and literally people not experience inclusion, and what role that plays in ensuring that people can show up authentically and experience authenticity in the workplace. We then looked at some potential solutions for that and came down to a boiling point where we said, what's really needed is an opportunity to center around equity first. And I introduced this concept of the equity first framework. What does it look like to start with the gaps that exist and persist, and to acknowledge, challenge the inequities that are occurring, and be strategically urgent? I then went over what is the web audit process, what we do, and how C4 partners with MHTTC and other organizations to audit their websites, their materials, their policies, their procedures, their onboarding, like all of the different things that are going on behind the scenes that really create and enhance a culture of inclusivity. And the different things that we might be assessing for, like neutrality in language. And we talked about why some people might be neutral in language. We talked about what are some of the intentional and unintentional consequences of avoidance. We talked about the importance of front-facing communication. And then today we'll talk a little bit more about what authentic change looks like. I then went over what is the process of the auditing lineage of work. And we talked about it, including a very important variable around accessibility. I then showed the metrics that we use in doing the audit. And in that, the point of me showing it was to say that an audit process doesn't necessarily mean that we only hyper focus on the negatives. In fact, we typically use a strength-based approach because there's often a lot of really great work that's being done, work that we know about that's being done, and work sometimes that we haven't even talked about, which leads us to day 2. That summary was really fast, but was it helpful? Do folks kind of feel caught up? Yeah. Okay, cool. Yeah. Any questions? Rule to revisit. Any thoughts or reflections? I know some folks put it in the chat to some of the things that we're hoping to talk about today, but any things that come up for folks that you want to bring into the space, or you're reflecting on from last week? Let's click in through to see if I see anyone in the meeting. Okay. Awesome. This is the actual slide that we left off, and I'm going to run us back through this one because this is where we're going to start today. And we're talking about these necessary ingredients for change. I was presenting right before this, and I kind of went through the same example that I took us through last week. And I asked, is there anyone in the room who bakes? And, I talked about how there is importance to not only have the ingredients to make something or to bake something, but to have the correct ingredients. And I gave the very transparent and vulnerable example of me learning the difference between baking powder and baking soda when trying to make a cake, right? Like there's a very distinct difference. You have to have the right ingredients in order for it to come out, right? And so I shared this image with you all, and I talked about how it's necessary to have vision, skills, incentives, resources, and an action plan. And so just to take us through this again, if we're working with an organization where people feel like they have the skills, they know what they're doing, they know how to do whatever the change is that we're planning to, whether that's trauma-informed care, racial equity culture change, improved service provision, right? Whatever that might look like, incorporating motivational interviewing, if they have the skills and they feel incentivized to do it, there's ample motivation for folks to do it. It's encouraged. There's a positive culture around it. People have the resources, whether that's the physical, financial resources, the time resources, and then they have an action plan. They have next steps, but they don't know what we're doing. Why are we here? What's the overall goal for the organization? That can lead people to have a distinct level of confusion. We might also see a circumstance where people have the vision. They know what the big picture is. They're bought into it. They're excited about it. They feel very incentivized to do it. They feel like they have the resources available to them to do it. And they know what the next steps to take are. But they don't know physically how to do it. They don't have the skill set. There haven't been opportunities for training or learning those skills to be able to do the task. That's going to leave folks feeling very anxious. Let's say you have the visions, you have the skills, you have the resources, the action plan, but there's no incentives that are a part of it. And people are going to make slow incremental change. You're going to see things happen gradually. You're going to have people propose that we start this up in 2024. And next thing you know, we're in June 2024 and the committee just got, enacted. And now the next steps, and you see that really slow progression of change that doesn't meet the urgency of the racial equity that you're intending to have as part of your organization. Let's say you have the vision, you have the skills, you have the incentives, you have the action plan, but there's no resources to do it. No financing, no time, no human capital, people's ability to do it. That's a very frustrating experience to know that everything's on board, but the right resources that are needed to do it are not available. Let's say you have the vision, skills, incentives, and resources, but there's no action plan. No one knows what the next steps are going to be. You'll start to see a lot of false starts, people trying things. I'm doing this in one department, Lee's doing this in another department, and we're all trying to come together to do something, but no action plan, no next steps have been outlined. You're going to have a bunch of different false starts. Throwing things at the wall, seeing what sticks. And so in this particular formula, it is recommended that there's vision, skills, incentives, resources, and action plans, but sometimes it's those ingredients and sometimes it's others as well. And so what might help us is to say, okay, well, what is the gap that we're experiencing in implementing racial equity into our organization? And how are people feeling? And then try to assess what is the ingredient that's necessary for people to feel really supported. So I'd like to start here. And, as you think about your team, your organization, and their goal and efforts towards racial equity to equity and inclusion more broadly, what ingredients do you feel like you all might be missing?
I think it's difficult to keep the eye on vision. I feel like we have a racial equity study kind of going on in our foster care program, and I was talking to just one of the players in the game, and do you remember why we're doing what we're doing? No. Okay, I know we've talked about this, but and so that's hard.
It is hard. That is hard. And it might be, the vision piece, but then there's also the buy-in piece too, right? Maybe the vision sounds great, but people aren't really all that bought into it. So it's a fleeting kind of experience for them. I think that's such an important point that you bring up, Jasmine. Thank you. Jasmine, another thing that what you said brings up for me too is how often do visions and missions drift, right? You have a vision for something and then someone else brings something in and the vision changes and it shifts and then we're all like, well, what did we agree to in the first place? That happens a lot. I see some folks are putting into the chat resources. Resources is a very big one. Incentives and action plans, ISIS. Yeah. What does lack of incentive look like for you all? ISIS brings incentives into this space. What does lack of incentive look like?
I can share what came up for me around that was thinking about what you had talked about last session around how when diversity and equity are integrated, that there are actual benefits that are, researched and proven. And I think that sometimes when folks are working in environments and they see themselves as experts in the work that they're doing, it's kind of hard to see past that. It's kind of hard to see additional benefits if they're already feeling like they're doing such great work and so many wonderful things are currently happening. It's hard to see past that.
Yeah, that's so good.
For me, my name's Devin, but for me, lack of incentives in the field I'm in is really because a lot of us are on salary.
Yeah.
So when you asking somebody to put in more effort and it's not the overtime pay, you know what I mean, or it's hard for them to buy in. It's hard for them to put that energy into it when they don't feel like the love is really being reciprocated. So
yeah, that merit piece. Yep, that's so important. Yeah, other thoughts? I like to talk about transparency in this space. And one of the things that I like to be transparent about too, right? This session is about specifically the auditing process. Like, how do you begin to evaluate where you are, where you need to go, what opportunities there are for growth. But a lot of times when it comes to topics like racial equity, the biggest gap that we have is knowledge. And this dilemma comes at a really interesting time. And I like to talk about this transparently because, well, the reality is most organizations are going through it. Most people would say, and I'd be interested what folks would think in this room, between, I would even say like 2019, but really 2020 to 2022, most organizations have more conversations about equity, inclusion, social justice, related topics than they had ever before, right? Some of us might be talking about racial equity in our day-to-day work, but the conversations between 2020 and 2022 happened at a capacity, right? It's just like, yeah, would other folks agree? Like you saw that more in your organization than ever before? Right. And there was this huge push, this urgency, if you will, to have conversations about racial equity. And so you'll see that there's like, I think there was a Forbes article and a New York Times article that started to come out in like 2022 that said, we've done all of these DEI trainings, and did they actually work, or did they create more conflict? And there's all this inconsistent results. And as someone who does equity training, people often ask me about it. Like, have you seen these articles that said, did DEI trainings really work, or did it create more complexity in the workplace? And I think that it's important to talk about those findings because they're real and they're valid. And what actually is coming up is that folks started to bring on disjointed efforts, training opportunities without action opportunities. We're responding to one part of it. And bringing in folks or having opportunities where we talked about the topic at current, but maybe not the history. We talked about the history, but not the current. We started conversations, but we didn't give people the skills to facilitate it. So a lot of us were engaging in these one-off trainings where we talked about diversity, equity, inclusion. We talked about microaggressions. We talked about racial equity, and people were really inundated with information, but people didn't have the next step, the tools to take that and to put it into action, which left a lot of people feeling really aware, learning a lot, feeling like they engaged a lot, but not knowing what to do with that information. And so we have to be really transparent about what happened during that time frame. What kind of training did folks get, and what training did folks not get? And I'm reflecting that this isn't a space where I'm training on race equity, but as a simple example, I go in and I talk about microaggressions pretty much on a daily basis. And many organizations have gone through microaggression training, but people don't know the history of the term. And so we're not really getting to the root of some of it. Organizations aren't using the same terms similar ways, which has caused some disjoint in ability to have and facilitate productive conversations. So it's not that we had these trainings and we should be further along, but how were those trainings building strategically on other efforts? How was there a connection between it? And for organizations that said, I did diversity inclusion training, we had everyone do it, it's done. We are seeing the consequence of that, where it is this now disjoint within organizations, which we can respond to by being strategic and understanding what are the gaps that are existing in organizations. So I think that that's really important to bring up as it relates to transparency. The other thing, and Nicole puts in the chat, I really appreciate this too, lack of incentives can look like people feeling like nothing ever changes. Increased knowledge and access for everyone is key. Exactly. Yep, Nicole, exactly what I was just saying. And then Devin mentioned about like, you know, people having all of these different roles or people being salaried. And then you get into this space where people are being asked to do more. And even earlier, I was giving the example of being a faculty member and being a Black professor. I often have students of color come to me all the time. Students of intersect and marginalized identity, they just naturally come to my office. I'm a safe place for a lot of them to process their experiences in higher ed. And so there's also an opportunity for when we have people in our organizations that are doing equity work to assess what is the meritorious nature of it. And that could look in a multitude of different ways. I think we started talking about this last week, but you know, it could be a place where someone comes to me, as using myself as an example, and says, we notice that you're taking on this additional responsibility and it's not part of your job description and it's not part of your work. And so as a result, we can assess for two things. Am I even interested in occupying the space? And if not, do we need to bring in more resources or more people to provide this type of support for our students that's clearly needed, as demonstrated by this increase of responsibility that you have? Or if you are interested and this is something that you're passionate about and this is something that you don't mind doing and enjoy doing, how do we now incorporate it into your role and reduce something else off of your plate so that you can do this in a meaningful way and have it be meritorious towards your, you know, towards your salary? Or how can we additionally compensate for this natural skill that you're bringing into the natural value that you're adding to the organization, and find a way to have that be reflected? And so it is about, that's, you know, that's an organizational change, but it requires someone to be observant to see that, to be willing to address that at an organizational level for those kind of patterns to change. And that's something that we would look for too when we're like auditing who's doing what and what those roles look like. I think the issue is that training required the leadership to hold people accountable. Yeah. And sometimes that's not happening, right? And it might be that leadership got trained on racial equity, but not got the skills about how to be equity-centered, trauma-informed supervisor, right? And so we have to continue to assess for gaps for continued growth. Before I go on to the next slide, any other ingredients that as we're having this conversation, people are thinking, I actually think we're missing this ingredient? If you're typing, please continue to type. I'm going to incorporate your thoughts. So I like to go through these. These are equity pitfalls. I'm not going to read all of them, but I like to talk about pivots. I use a strengths-based approach, but these are pitfalls that we typically see it from future. These are just the pitfalls, but every pitfall comes with an opportunity to pivot. And I think that that's really important. So when we're doing an auditing process, we're always thinking about these different potential pitfalls that organizations can experience, and then thinking about how to pivot from those pitfalls. So one of the first pitfalls that we see are people try to do equity, right? It's a series of trainings, like 5, 2, 1. It's a one tool that they're going to do, a 1 5-point plan instead of seeing it as whole system, whole organization, whole person change, and recognizing that there's healing and identity that goes into that. And so when people say we're going to do this equity thing, you know, it really kind of highlights that maybe there's opportunity as we audit to see what kind of systems change are they actually looking for, what kind of people, experience and perceptions are they trying to nurture in order to get the outcome. The second pitfall that we typically see is that work being siloed. Now, it is true that there's going to need to be a consorted group of folks who take the work to the next level. That is really important. That is essential. But there's also the siloing where it's like the equity leadership, the JEDI, AA, EIA, DIA, DEI. What acronyms do y'all use, right? I've seen a lot of really creative ones, right? That group is going to do this. And we're so grateful to that group that's going to do this, and kind of deviating from seeing it as everyone's lane. And then when that group does it, they bring it to us, and then we receive it, use it, put it on our desk, put it in a drawer, right? So this work is being really contained to a group as opposed to the empowerment of all people to see it as their role. So that's another thing we're really looking for in this auditing process. There might be a particular like charismatic leader. So you have that person who, again, whether it's because if they don't do it, someone else who's going to do it, or because they're really passionate about it, is a really evoking leader in the work. But when they leave, the equity conversations leave too, because they're so good at facilitating it that other people don't have to learn the skills too. And so therefore they become this like person who really, really, you know, carries the work. But the consequence to that is that it's really reliant on them. You have folks who just try a lot of things, bring in a lot of experts. Those experts are helping to build experts in the room. So you have people who are just trying things. And then you have folks who are just like focused on the emotional or equity intelligence building of folks, but not the organizational change. So you'll start to see organizations do really good at building up their people, but not changing anything in the organization. Or you'll see people who are really good at changing things at the organization level, but not nurturing into the people. So it can be a multi-directional conflict that way. You know, you have like a blanket equity where we talk about it really generalizably. That's something that we're really assessing for. Instead, we want to be able to look at what are the different and unique experiences folks are having, and then how does that connect to, you know, what are the intersectional then, like, you know, this person is experiencing ableism in the workplace and gender-based oppression and racism, really looking at that intersectionality. And then you have, you know, superficial responses. You have dumping a whole bunch of money, but not time, and don't you have time, not money. So these are some of the pitfalls that I think are really helpful. And on next slide, I'm going to show us some pivots that come from the slides. There's a really great question that comes up really on the tail end of the last slide and building into this slide about different ways to incentivize people and organizations. And I think when we're talking, I like to go to the extreme to say, like, when you have people who are really resistant to change, sometimes the incentivizer can be to see the progress that happens when change occurs. So moving forward with change can be a great incentivizer, but I also think that there are ways that change can benefit people that might not be super clear or the same as other people. And so we have, I kind of remodeled a stakeholder engagement map for us to kind of move us away from the language of stakeholder, but to really see how to get people incentivized in organizations by being strategic in the upcoming slide. So I think we'll cover that a bit too. Really great and important question. Thank you. Equity culture shift involves resisting the notion that we can do equity, right? And instead asking ourselves, are we being equitable? And how are we being equitable specifically? Develop leadership and management that's prepared to respond It's a skill to build. Not everyone who is a leader, not everyone who's a manager, not everyone who is a peer knows how to promote equity. And not every person who identifies as a with a marginalized identity wants to be the one facilitating that conversation, right? So we want to really develop everyone and their ability to respond and to create inclusive spaces. We want to make equity-centered practices a part of the culture. So if you're doing regular check-ins, so when we're doing the auditing process, we're asking, what kind of check-ins do you have? What kind of hiring process do you have? What kind of promotion materials for positions do you have? And if equity is not baked into that, then when people come in, they don't know that that's the baseline culture that you have at your organization. So you want to make sure that every check-in involves something like, okay, so how are we thinking about this for folks who are most marginalized? Put it into the morning check-in, because it helps people not only get used to thinking about it, but talking about it. And that's actually one of the biggest barriers when it comes to equity, is people don't feel comfortable to talk about it because it's not typically discussed. You want to build up informed leaders within an organization so it doesn't rely on a single charming individual. Lean on the strengths of people themselves to see themselves as capable to contributing to culture shift. It's everyone's lane. And then making the investment beyond superficial and performative initiatives by leading with sustainable, urgent, and strategic planning. So we started talking about photos last time, and I got a few questions at the end of our training, our session the first time. And I actually get questions about photos a lot. So when we're doing equity audits, a lot of times people will have photos like this on their site. These are women in leadership, diverse women in leadership, if that's the search you're doing, teams, diverse teams. Besides, let's navigate past the surface levelness of it. I honestly think that I found it really hard to find some of the really super generic ones that we have historically used. It seems like most of the general stock images are more diverse faces, happy faces, people working together in this way. Well, what do these photos evoke for you? Nothing. If your answer is nothing, you can say nothing. What do these photos evoke for you? Perfectionism. What else? Representation. Gender equity and empowerment. As I mentioned, I think that these photos are probably a step up from, I didn't pick the ones that were intentionally we could be like, this is clearly problematic and here's why. I think these are more of the photos that many of us would probably actually use on our sites if we were using general stock photos. And the intentionality might be to demonstrate representation. Sometimes we do this to an exaggeration. We'd show pictures of diverse faces when that's not actually really representative of what we have. So there has to be some authenticity to it. So if I see pictures like this on someone's site when I'm doing audit, I say, who's the population that you serve and in what capacity? And when I look through their disaggregated data on through race and gender, if that's not really who the organization's serving, then what is the reason behind it? Is it to depict something that's not genuinely or authentically there? Is it to motivate or inspire people who aren't there to feel welcome? And that's a really important question to ask. We might think that this is just about choosing photos, but it's so much more than that. Even with these photos not being the ones that we would maybe steer away from because they do represent a different type of inclusion, what is missing from these photos?
So when I look at the backdrop of the photos, I see nothing that represents anybody else's culture in those photos.
Mm.
So, it's like a lot of the times when you go into a place and you're a client, you want to feel comfortable in those places.
Yeah.
And, signs and symbols are for the conscious mind. So if I walk in somewhere and I don't feel like this place is for me, then most likely I'm going to be closed off.
Mhm.
So when I look at the photos, it's nothing that represents my background in any of those photos.
I do a lot, to your point, I do a lot of work with recovery houses. And one of the things that I often talk about in recovery houses is, well, this is somewhere where someone's living. What about the space? Tell someone, hey, this space can be even culturally adaptive to my experience, right? We keep them stocked with different products and supplies. Are we thinking about the cultural, relevance of those products and supplies? To your point, it's about the conscious experience that we're having. Who do the pictures represent? And also on the flyers, in the slides, right? In the magazines, what kind of hair products? Like we could stay really surface culture before even getting into any of the depth culture, like communication styles, about ideas about relationships and communications. Just staying at the surface level, there's so many automatic cues that we have going into a space as to whether or not it is a place for us. Yeah. So some observations folks have had. The first pictures are very corporate. Yeah. Second one's more mixed. They're very neutral. Yeah. I just looked at the background, right? All of these are really kind of open office spaces. I've never actually worked in a space that was open like this. I don't know, maybe some of you have, but a lot of the organizations or places we work with don't have it. Yeah, the pictures are very neutral, a lot of beige tones to them. Cookie cutter pictures, no real depth, pretty transparent. Mm-hmm. It is reflective of socioeconomic settings, right? There's also very little, I'd argue none. Some of you might argue some, but I'd argue none. Body diversity in these pictures. I would argue that there's no body diversity. Matter of fact, I don't see anything about accessibility in these photos, right? And if I'm thinking about the folks who I work with or the populations that I serve, they're diverse in a lot of ways. When they did this photo shoot, they were very thoughtful in that they said, let's bring in people from this racial ethnic background, this racial ethnic background. Let's not have people sit too close together. Gonna make sure you're at the end of the table right here. Make sure you're smiling, we're happy. We got some ambiguity. This might be a white gentleman and might be a Latino man. We don't know. There's some ambiguity. My goodness, there, right? We have this perceivably Muslim woman who's very in a leadership authoritarian. We have these stout faces looking at this strong woman leader. We have the arm fold. Again, strategically place people around the table. Whoever shot it was shooting a picture for racial and ethnic diversity. But again, we go back to this critical intersectionality and what do the people who work in our organizations and what do the people who we serve look like, and does this represent them? This does not look like the place that I work. I'll tell you that much. So we're getting to a place where, like I said, I'm happy to see that when you search workplace, this is what comes up as to what came up before, but we're still in a space where we're continually growing. And so if I want to feel connected to an organization, I'm really looking for things that not only reflect maybe me or my experiences, but people who I know's experiences. And more so than that, something that says I've put in thought to what your experiences can be like, which gets us to this point of neutrality that I brought up last time. We tend to be quite neutral, and it's often very strategic. We don't want to say the wrong thing. We don't want to overpromise. And so a really good place to start with is trying to reflect who we want to serve, trying to reflect who we are already serving, right? And if we find that there's a disjoint between who we want to serve and who we're serving, then it might be that really good opportunity to navigate from a space or positionality of accountability. And in the auditing process, this is what we do. We say, all right, you're recognizing that you're serving this population, you intend to serve this population. Instead of putting photos and images that reflect the diversity you want to see, why don't we put the language and intentionality into saying this is a goal of the organization and speaking to the issues that would marginalize the folks who aren't coming to your, like that is a, and that scares people. And I understand why, but are we really trying to connect with people from what they can see? They didn't get a chance to meet us. We haven't had a chance to tell them how great we are. We haven't had a chance to make people feel welcome. We have what people can see. And so there has to be a level of vulnerability and transparency that's reflected in the materials. When we're trying to do this at an organizational level, you will come up against things like change fatigue, compassion fatigue, decision fatigue. And as a clinician, I talk about change fatigue and compassion fatigue often in the context of like serving people, or a lot of the work that you all are doing are with populations who experience a lot of trauma. So you see a lot of compassion fatigue in terms of the work. And also in this move towards racial equity and equity and inclusion in our organizations, we're seeing compassion fatigue there too. I'm tired of talking about this. There's two sides. I'm tired of talking about this, and I'm tired of talking about it. I'm living it. I want to see some action, false promises again and again. So no matter whether someone's tired of talking about it because they have the privilege to remove themselves from it, or whether people are tired of talking about it because they're tired of empty promises, we are seeing that fatiguing happening, that change fatigue. We're seeing decision fatigue. I love talking about decision fatigue, and I often give an example of this, I think, pretty amusing research that folks did, where they had half of a group got a voucher to choose between 5 different ice cream flavors, and the other half of the group got a voucher to choose between 50. Everyone thought that the side that had 50 was going to be most excited because they had the most options. When we really sat back and looked at the outcome of the research, the group with 50 actually enjoyed the experience less because they had too many decisions to be made, where the group with 5 picked what they picked and they were happy with it. And so we can see this example with ice cream, but when we think about it in terms of the people we're serving, or the people who we're working with who are serving communities that we're part of, what this really looks like is people making lots of decisions in the interim between our desire to be equitable and us being equitable, making decisions about how to show up, how to contribute, and how to be safe in a space that would otherwise seem very vulnerable and not so safe. What do you? What do we think? How do we see this? Are you seeing fatigue in this process? in your organizations. I see some head nods. Yeah. Yeah. Take the path of least resistance. Yeah, absolutely. So thinking about this, like passively least resistance, you know, well, some of you may know, some of you may not be familiar. Again, nothing in me wants to more go into depth as to why, but I try to stay focused sometimes. You know, when we're being strategic in the auditing process, we like to think about who to engage. And a lot of times we refer to that as stakeholders. In the work, we're really trying to move away from the term stakeholders. There's a lot of history and origin. If you're not familiar with the origin and like literally breaking down stakeholders, there's a lot of oppressive history with stakeholding. So the language of that is being moved around. So you see that I have that marked out, but we're really talking about our engagement of people who are invested in or hold a stake in an issue, right? And so this is a pretty straightforward strategic stakeholder mapping system. You have basically people who have the highest power and the highest levels of interest. Those with the highest power, you want to keep them satisfied, you want to manage them closely. And then people who have lower power and less interest, you want to basically keep at bay. And so this is how anyone who's ever done a business degree, you kind of were taught to engage. But considering what we just talked about change fatigue, compassion fatigue, burnout, right? Recognizing that burnout's not an individual flaw, but an organizational issue as well. Nor is it a flaw at all. It's the accumulation of really real, valid experiences that folks are having. And to the point that Isis puts in the chat, the nature of human to take the path of least resistance, who would we really want to include? And so we really remodel this to talk about partner engagement mapping, to say that typically folks who we would consider to be low interest and low influence might be people who are afraid or fatigued by the change. They might be folks who are discouraged by lack of change. And it is equally as important, if not more important, to keep those folks engaged and involved. This is a very different way of thinking about it than maybe many of us have traditionally thought about it. You also have people who are perceived low interest, but maybe occupy high influence. Those are folks who might benefit from the lack of change. If this doesn't change, then my job's not a threat, right? Maybe folks are unaware. Maybe it's not that intentionality. Maybe folks are just unaware. But those folks still need to be communicated with, which goes back to the question that we brought up earlier about what are different ways to incentivize people in organizations, understand what this change means for everyone in the organization. And that means engaging everyone at every role and capacity. We don't know how it's going to impact someone. How can you incentivize them? We try to do a one-stop shop incentive. We're going to do this as a team. We're excited. Or if you do this, the incentive is going to look different based on the impact that it has on that individual. And so incorporating people meaningfully is a big part of the auditing process to see how are people participating and how are people being included. I have for us planned to talk about Kotter's 8 stages of transformation. We don't have time to go through all of them now, so I'm going to pivot us to a different slide to close us out. But before I do that, any thoughts or questions?
I think the information that we just talked about gave me a little bit more compassion
Mhm.
for the audience that's not captured, or, I feel like we've talked about this, but there's so many other changes going on, there's restructure or technology, we got to use a new system, all that other stuff that happened. So thank you.
Yeah, thank you. Thanks for bringing that up. Because it is true. There's so many different reasons. And we can ask people, but oftentimes, the other part of it too is that when we look at that stakeholder, if we were looking at it in a traditional sense, it would say that the person with high influence or high power are the people who we need to keep most informed. A strategic flaw in the organizations like we work in with that kind of framework is that that's usually a really small subgroup of people, which means that it also really minimizes the impact that that larger group of potentially uninterested or resistant people, or like just the nonchalant folks really have. Because to say to keep those folks uninformed or, inform them as necessary means that if folks don't agree, if enough folks are resistant, like I'm not using that new technology, it's highly likely that that's going to influence that high power, high influence person more to do something different. So really, if we focus our efforts on meeting the needs of people who are often encouraged or engaged, we're really building that capacity to incentivize the majority of folks, because that's really who changes or shifts an organization. People who day to day are made to feel or do feel powerlessness within an organization occupy extensive power and influence in a very positive way if the opportunity is presented for folks to be engaged and collaborative. But our business models just have not prioritized that for a multitude of different reasons. Any other thoughts? That's so helpful. Love how y'all frame things. For folks who kind of looked at your organization's page, whether you chose to bring like a mission statement or a or page or material policy procedure, do you see this neutrality reflected in any part, right? It doesn't have to be the organization as a whole, but are there any inconsistencies between what you all are trying to do and the information that you're putting out? Yeah. Lee, correct me if I'm wrong, but I think we have one more session to kind of go through those. Okay. Thank you. Lee's a mind reader, I tell you. The policies are aligning. Yep. Okay. Yeah. So Lee created a third session for us, same time next week, to kind of look through those and engage with them. And Lee put that link in the chat. And what I really want to prioritize in talking about that is that this strategic authenticity through the auditing process, where we'll kind of work in groups. I'm just letting folks know if you come next week, we will be in groups. So I encourage folks who want to or prepared to be in groups to do that. We're going to talk about what does it look like to acknowledge, to engage in accountability and take action. I usually help organizations develop North Stars to guide their work. And this is one of the things that I use to help them break that down. What do we need to acknowledge? Where do we need to take accountability? And what does action look like? So we'll use this formula in alignment. We'll go through other stages of transformation, and then we'll look at something from your organization and see what might you be able to even propose in terms of a single change, depending on what your role looks like in an organization. So if you're interested in doing that, I highly encourage you to come back to our didactic or tangible session next week, where we'll spend some time really looking at the materials, and I'll give a handout for folks to kind of use in your groups with your materials. Thank you all so much for your time today. I've enjoyed our conversation as always, and Lee's going to close us out.
All right. Thanks so much, folks, for joining us again for today. We have some questions that folks have given us in the chat. Just so you know, all of those questions will be tenses are hard, will be provided to Ashley before next week's. But the link in the chat that I just placed is for that third session. We added that because of so much interest in talking further with y'all about your specific experiences, and that is also available. So I will also be putting that in the chat once more. But just so you know, we have an evaluation for today's session. We are required to evaluate our services because of our grant from SAMHSA. So it would be super, super helpful for your honest, anonymous feedback that will provide us work in the future in planning future meetings and programs. And we really, really appreciate your feedback, as well as attendees who put their email address in the chat. I will follow up, and I will be sending out this survey again to folks who have attended, and folks who attended our previous one will also get that. And thank you for the participant in the chat who just put that link. Appreciate you. You can also use the QR code, or again, use that link in the chat to do our evaluation. And thank you again for participating. You can follow us on a variety of social media to see what we're doing. And as well, hope that you'll join us for next week's, like we said, a little bit more about your experience in this particular area. So thank you for everything. And as Ashley said in the chat, if there are any other training topics that you'd like to hear about that you haven't seen, put up in various places that you might see, please put them in the chat, and we would love to work with you and develop more trainings that fit exactly what you're going through. So please add any thoughts in the chat. I'll keep it open for a little bit ahead of the meeting. And we again thank you for joining us for today's event, and hope you'll join us for next time.